everyone for attending our ID series today. We are delighted to have Christine Brown from ChristianaCare giving us a talk about Teachback, a very important topic for any health system and even more now relevant now as October is Health Literacy Month. But before I introduce our speaker, let me go over some housekeeping issues. So as usual, we will extend CME credits for our Tech Talks and our ID series presentation. We will distribute the information via email to those that registered for today's event. However, if you did not register, you can still obtain CME code information from Deborah Rees at ChristianaCare, and I'll give her email address in the chat. You do not want to miss our upcoming presentations. We have really a really wonderful lineup for the next few weeks. On November 4th, we have a Tech Talk with Mary Jo McDuffie from University of Delaware, who is going to talk about Medicaid data for research. And these Tech Talks will be followed on November 11th by a presentation from Katie Fitzpatrick, also from University of Delaware, who in fact will talk about her research using Medicaid data specifically to the title of her talk is Does Increased Use of Long-Acting Reversible Contraception, or LARC, Have Unintended Costs? So do not also miss this presentation. On December 2nd, we have another Tech Talk from Dr. Mustafa Oskenak from University of Colorado, who will talk about workflow analysis. And then on December 9th, we have another ID series from Dr. Kutuli and Achimonji from Nemours, who will be talking about homelessness in high school. So this is really a wonderful lineup. So again, I'm really delighted to introduce Christine Brown. Christine Brown is a nurse and an educator working as a nursing professional development specialist at ChristianaCare. She has obtained a Master's of Science in Nursing Leadership from Wilmington University. She has had multiple personnel awards, from Top Nurse in Education Mentorship from Delaware Today to the Nursing Excellence Award from ChristianaCare, as well as team awards such as the Magnet Transformational Leadership Gold Award. So thank you so much, Christine, to talk to us about this very, very important topic, and we look forward to your presentation.
Thank you very, very much. Hope everybody can hear me okay. Remember to turn my mic on. We're going to do a presentation called Getting Started with Teachback. And I'll share my slides in just a minute. To get started, I wanted to just say first of all, Happy Health Literacy Month. Health literacy is about helping your patients understand their health and their families as well, understand what's going on with their health. So this topic is very close to my heart, not only as a nurse, but also as, we're all patients at some point in our lives, right? But I did have a son that had leukemia. So, and he was treated at Nemours. I understand we might have some people from Nemours on the call. So thank you for all that you do there and at all the healthcare facilities. But I want to share a personal story about how Teachback could have made a difference in my son's care. But, this was back before people really started embracing it. He was 5 when he was diagnosed with leukemia, and he's now 21 going on 22. So obviously we've had a good outcome and very happy about that. I would say 8 months into his treatment, one of the things with leukemia is you get 3.5 years of chemotherapy if you're a boy with the type he had. And one of the chemotherapies I had to give was on a daily basis. It was a pill. And I went to his doctor's appointment about 8 months in. He had been getting it all along. And we're doing our med history review, our med reconciliation, and she's reviewing the medicines with me. And when she goes through them, she said, okay, now that one, that was mercaptopurine, I believe. She said, you're giving that one on an empty stomach, right? And I was like, no, I'm not. I'm like, why? He gets all of his pills at night, right when he eats his dinner so that he doesn't get sick afterwards. And she was like, ooh, she goes, that one really should be given on an empty stomach. She said, so, make sure you start doing that. Well, all that's going through my mind at that point is, oh my gosh, is his leukemia going to come back? And is it my fault because I didn't know the medication instructions? So there was a lot of teaching that went on at that wonderful facility. They taught me how to take care of central lines. It was before I was a nurse. A lot of wonderful teaching went on there. But I don't know if I was ever asked to do Teachback. I don't remember it specifically on my medicines. So just think something like that little, like not giving a medicine on an empty stomach. If somebody had asked me to stay back when I was reviewing medicines with them at one point, tell me how you're going to give this medicine. And I would have been saying, oh, I'm going to give it to him with his dinner. And they would say, no, 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 that one goes on an empty stomach. So that's an example of a time where Teachback could have helped somebody. And luckily we had a good outcome. Luckily it didn't change anything too much. He might have had medications adjusted, like he might have been taking a higher dose of the mercaptopurine, perhaps because I wasn't giving it on an empty stomach. But think about that moment as a patient or a patient's mom that I might have had, being stricken with that scare, that I might be responsible for bringing on a disease that could destroy my son's life. So little things like that make a huge difference to patients. And out of all the teaching that was done, of course, there's going to be little things that get missed, right? That's a big disease, leukemia, and it has a lot of chemotherapy and a lot of medicines and a lot of things you have to do for a long time. But, that would have been one of those times where Teachback would have been very helpful for a patient's family member to have done. So that being said, I just wanted to share that and let you know that we're all doing things every day that are important to patients and families. And Teachback is just one of those things you can start to embrace in your practice to try to help your patients and families understand better. All right, so enough of my long personal story. Let me get into sharing my slides here. All right, and anybody can't see my slide. Okay. So welcome to Getting Started with Teachback, a way to help your patients understand their health. Thanks for taking this important step in helping your patients and families understand their health. Just a quick mention that those involved in the development of this course have no conflicts of interest. And you're already aware that this course is good for a CME credit. So what are the objectives? So in this course, you're going to learn the why, when, and how of Teachback, and you'll also learn how to teach your clients key points using plain language and how to use caring questions to prompt them to teach you back. A quote I love, Benjamin Franklin once said, "Tell me and I forget, teach me and I might remember, involve me and I learn." Teachback is a way to get your patients involved so that they understand their care. So what is Teachback? Why is it important? When is it used? Let's find out. So the Institute for Healthcare Advancement is an organization dedicated to empowering people to better health. It offers a comprehensive definition of Teachback. It begins by explaining that providers need to explain things clearly and check for understanding by asking for a return explanation in a caring way. IHA also shares in their definition that it's an opportunity to clarify misunderstandings and is research-based intervention that promotes patient adherence and quality and safety. Another important organization that's defined Teachback, the Agency for Healthcare Research and Quality, calls Teachback a technique for healthcare that providers make sure that they ensure that they've explained medical information clearly so that patients and their families understand what is communicated to them. So here you'll notice the emphasis is put on the responsibility of providers explaining things clearly. And then there is the Institute for Healthcare Improvement. This organization focuses worldwide on improving health and healthcare using science and hard work. They include Teachback in their Always Events program. And this program strives to translate person and family-centered care principles into tangible actions. Teachback is identified by them as part of the patient experience that's so important that providers should reliably use it all of the time. At ChristianaCare, we kind of developed our own definition. It's in line with all the others. But basically, we say that Teachback's a way to make sure that you explained information clearly by asking someone to explain things back in their own words. So we generalize the definition in order to reflect to our caregivers the importance of using this worthwhile technique. We recognize that Teachback is more than just a tool for clinicians to use with patients and families. It can be used by anyone, anytime, anywhere, to ensure that the other person understands when they're explaining important information. So, what is Teachback? Teachback is a way to check for understanding. Asking someone if they understand isn't really good enough. It's too easy for someone to nod or say yes in answer to that question. So think about this. When was the last time that somebody asked you if you understood that you said no? Normally you say yes when a person asks you that question or somebody asks you that question. It's an automatic response. We don't even think about it. So it's a clinical intervention and a skill. I'm sorry, back to that first bullet point. I advanced too quickly. Often people do not want to admit that that they weren't following you or got distracted or weren't paying attention when you were talking. Teachback takes away that easy answer of yes. Like I said, it's almost instinctive for us to nod yes when someone asks us if we understand. And it replaces that yes with a time for the patient to actually think about what was said and then respond back what they understood. So they're giving you the specific thing that they understood from what you explained. Teachback's a clinical intervention. It's a technique. It's a technique that consists of a series of communication enhancements which support clarity and understanding. While Teachback is an easy concept to grasp, it's not necessarily easy to do. It doesn't feel natural all the time. Therefore, it's a skill that requires practice. It doesn't feel like a natural part of the conversation until you've practiced it, and then it does become more natural and more easy to use. As you practice it, you'll gain confidence with using it, and you'll also become fluent at using it. Teachback is an interactive communication loop, also known as closed loop communication. It's a way of getting everybody on the same page, making sure that the teacher and the learner are on the same page. And it's a way to help you meet people where they are. It's also helpful for you to know what Teachback is not. Teachback is not a test or a quiz or a series of like short answer questions that you shoot at your patient and expect them to reply back. That can, being tested can scare people and can make the situation feel intimidating versus caring and understanding. Teachback isn't asking the patient or family member to repeat everything back word for word that they heard you say. Obviously, that wouldn't be efficient for you or for them, but it also, again, would be intimidating, whoever can repeat things back word for word. It's not talking down to the other person. You're not necessarily talking down, you're meeting them where they are. It's also not educating up, meaning a lot of times professionals expect patients and families to kind of learn their terms for things, learn everything they need to know about things. And they don't always need to know all our terms and everything we know about a topic in order to take care of themselves. Contrary to popular myths, Teachback is not difficult or time-consuming, but it is worth it. It's worth it because you're meeting people where you are, you're making sure they can recall things in their own words, those things that are most important for them to know or do in their care. So, Teachback's recommended. As healthcare professionals, we look to reputable organizations to help guide our practice. Using Teachback is recommended by the Joint Commission, the American Medical Association, the Agency for Healthcare Quality and Research, and many other organizations that we rely on. It is recommended to improve patient understanding and safety and outcomes. But most importantly, patients appreciate it. In one study of 100 patients, they were asked to watch 2 videos. One video had the doctor asking the patient if they understood what was explained. So it showed him teaching and then saying, did you understand? In the other video, the doctor did the same teaching, but then asked the patient to explain things back in their own words. The overwhelming response from the survey participants was that they preferred the Teachback method. So another reason why we need to use Teachback is that 1 out of 3 US adults has low health literacy, which means they have trouble understanding basic instructions like how to prepare for a procedure or a test and how to take medicines properly. So 1 out of 3 adults in America. Pretty serious when you say something that way, because this is America. Studies also show that patients forget a lot of the information they get in healthcare encounters. Studies range from 40 to 80% is what they're showing that patients forget during their healthcare encounter. So think about the time you spend teaching, and basically patients are forgetting over half of it. Then what they remember of what we teach them, they're remembering half of that incorrectly. So basically the time you spend teaching, only about a quarter of the information is really being retained correctly by your patients. That again, to me, is a scary thing. 1 out of 3 adults in the United States, and they're lucky if they remember a quarter of what we say in the right way. Also, it's important to note that 98% of medical errors are related to communication problems, and that's evidence-based. So, regardless of the reason for their visit, patients experience emotions that can interfere and block their understanding. Even when you expect that your patient has good health literacy, there are things that compete for their attention. This is especially true when you're delivering unexpected or bad news, but it also can be true with good news and routine care. There's definitely distractions that get in the way. There's things people that are going through, or plans that they're making, or bills they're paying. Maybe they're making vacation plans, and that's their mind's wandering. So they're not fully attentive necessarily during all their healthcare visits, even if it's a wellness checkup. So even if they're not afraid or emotional about something in the negative sense, like it's not a cancer, maybe a cancer diagnosis, you can see where people would be blocked by that fear, and that fear would block the understanding. However, even like a wellness visit, if somebody's thinking about the bills they have to pay, or that they have to pick their kids up at school today, they're not focused entirely about on what you're saying, and that can affect their health negatively in the long run. Maybe they're not going to get that mammogram that you just told them they really need to get, and that mammogram might have saved their life. So let's talk about the research and the evidence around Teachback. In a systematic review that was recently done, 19 out of 20 studies were selected as being moderate to excellent quality studies. And in those studies, 19 out of 20 of them, Teachback proved effective. The results included a wide variety of settings, populations, and outcome measures, and there showed to be improvements in both learning-related outcomes and health outcomes. The authors of the study concluded that the overwhelming effectiveness of Teachback that was reported in 95% of the studies they reviewed, and across such a broad range of groups, patient groups, and outcomes, supports the use of Teachback in enhanced education and clinical practice. So let's look at the specifics of those studies. So emergency, there were three studies of emergency patients, and it showed increased comprehension of medications, self-care, and follow-up. In 4 studies of diabetic patients, it showed increased medication adherence, dietary changes, and foot care. In 2 studies of COPD patients, they showed increased use of using the correct inhaler techniques. In 2 studies of heart failure patients, there showed to be slight decreases in the readmission rates. In 3 women health studies, there was increased knowledge of self-care, improved quality of life, and improved anxiety. A study in breast cancer patients showed an increase in happiness when Teachback was done. A study in neurology patients showed increased satisfaction when Teachback was used. A study in older adult patients showed they actually measured health literacy scores, and with the use of Teachback, it showed improved health literacy scores. And in pediatric patients, in one study of pediatric patients, it showed improvements in patient-centered communication and parental engagement. So you can see there all the improvements, all the valuable reasons to use Teachback in a variety of populations. So you don't have to do Teachback on everything you discuss with your patients, families, clients. Think about what I've taught you so far today. Like if I did Teachback on every one of these things, obviously it wouldn't be efficient. We'd need 2 hours for the presentation, and then plus I'd have to do it on every one of you here, which wouldn't be efficient at all. But if I was working with a small group of you, it's definitely something that I could work on the key points of my presentation. And what my key points of the presentation would be my objectives that I went over at the beginning, right? So same thing with your patients. You want to think about, what are my objectives? What do they need to know or need to do to take care of themselves? So it's good to use Teachback when explaining the most important things that are going to affect their health. For example, what medicines they're taking, maybe their next steps for treatment, like the things they have to do next, and when they need to call for help and who they need to call for help. It's not that these other things listed aren't important. These are just the 3 I picked from that list. These other things are important at different times in the healthcare encounter. And so maybe you do Teachback at different times on those things. But the key things are like in this case, in my example in my head, were the medicines, the next steps, and who and when to call. So I'm going to focus on doing Teachback just on those things, even though I might have touched on all of these things. Make sure that my patient has resources or supplements that discuss these other things so that they can look at them later and make sure they understand them as well. So reviewing a few important points at a time. Don't wait till the end till you explain everything to do Teachback. If you pick your important points and periodically throughout the conversation you do Teachback on them, then you're more likely to help the patient retain the information. If you find yourself getting ready to ask the question, do you understand, or do you have any questions? Remember, they're yes/no questions. So much better you use an open-ended question to hear what the patient really needs, because otherwise, if they're doing yes/no, it's going to be an instinctive answer. No, I don't have any questions. Yes, I understand. That's usually what people will answer. So switch that up a bit. Use an open-ended question, like what questions do you have? What more can I tell you about this? But that's your prompt. When you find yourself starting to ask those questions, either switch it to an open-ended question or use that as a time to do Teachback. So to be sure I was clear, what did you understand from what we just talked about? So I can make sure that I covered all the important points. So when should you use Teachback? Well, like I said, you don't have to use it all the time, but maybe to begin with, since you're new to it probably, choose a Teachback moment. And whenever that moment occurs, use it. So what I mean by that is maybe if I'm an acute care nurse, my Teachback moment is maybe I give Coumadin a lot. So maybe Coumadin is going to be my Teachback moment, the side effects of Coumadin, or how important it is to get your labs with Coumadin. Like teach some key points about Coumadin, and then I'm going to have a Teachback moment with that patient anytime I give Coumadin. At first, I might not do it in my other patient care just because, like I said, it's not really a natural part of conversation. But as I get used to doing it with my Coumadin example, then I'll get better at it and I can incorporate other Teachback moments. So pick your Teachback moment. What will work for you? What do you do a lot? And then take it one step at a time, one moment at a time, one patient at a time. Don't try to do Teachback on everything, on every patient all the time, because you're going to overwhelm yourself and you're definitely going to get frustrated and stop. Pick a moment and stick with that moment. For example, maybe it's going to be when you prescribe a new medicine if you're a prescriber. Maybe your last appointment each day, if you're an ambulatory provider, maybe that's the best time for you to do it because you don't have another patient waiting in the wings, so you're willing to give it a try then. Or maybe it's just when you explain when and who to call for help, because that's such an important part of any office visit, any hospital visit, right? Is when does that patient need to go for help and who should they go to for help? Is it an ER visit or is it a phone call to the doctor? So that's something definitely that might be a value-added moment to use Teachback. So you start with one moment. And when that feels natural, you add another important moment. You keep adding moments to your practice until soon it's a normal part of your conversation. And then that becomes the foundation of understanding and confidence that your patients need to be safe, healthy, and achieve positive outcomes. A little building block slide there. You just use building blocks. So the basics of Teachback. How do we do it, right? Now that you've learned the what, why, and when, how do you do it? It's 3 easy steps, basically. So we're going to start by explaining key points, the things patients need to know, need to do. Before you start explaining things, you need to do like your learning needs assessment. You need to identify the needs and the barriers and address those right up front. So you're already aware as practitioners, I think, of some of the most common barriers and how to address them. I've listed a few of them here and some possible interventions. Your patient might need hearing aids or eyeglasses. You might need an interpreter if there's language differences. Sometimes cultural beliefs or religious beliefs or practices might require you to be a little more flexible with the plan. You might even need to initiate like a cultural consult for some tricky situations. Your patient's condition might call for the use of supplemental materials like leaflets or videos in order to help them understand things better. Or perhaps you sometimes have to delay the discussion till a better time. Maybe it's not the right time to have that discussion with the patient. I love to use the example of a patient that maybe just had pain medicine like Dilaudid or Ativan for anxiety. They might be a little sleepy, might not be the best time for me to go in there and teach them about the side effects of a new medicine we're starting later that day. One of the best interventions, though, as you can see, it's repeated multiple times here, is the use of a support person, a family member, a friend, a caregiver who can kind of help that patient remember and carry out the plan of care. So consider what matters most to your patient and what the care plan requires. They're the 2 most important things, the goals of the plan of care, the goals of the patient. Frame your message so that the patient recognizes that the information you provide will help them meet their own goals, okay? Without this framework, crucial next steps will likely be missed due to a lack of understanding. Conversations during patient encounters can, be quite fluid. They change, they meander, they take their own directions. So they take unexpected turns. That's why it's important to know what your most important points are and deliver them clearly. So start with the most important message first for that patient, message or messages. Try to focus on 3 key messages at a time. If you have a lot of information that you need to deliver, then chunk and check in groups of like 2 to 4 messages. But remember, it's okay if you can't deliver all your messages right away. Take the cues from your patient and deliver only what the patient can handle right now. Okay, like I said, you can use other things to supplement the other messages that maybe you're required to deliver. Maybe some things are required to deliver because the patient needs to know them eventually, but there's certain things they need to know and need to do in order to get from today to the end of next week, right? So let's get those delivered and do Teachback on those and maybe supplement everything else so that they're not overwhelmed with information. They can look at the other information when they're engaged in it and when they have the time and when they already know what the plan is and what they have to do. So let's talk about chunking and checking. When there's a lot of information that needs to be shared, make it bite-sized. That's what I like to call it. First, chunk, which means breaking things down into smaller segments that fit together, and then check that those points were understood before you move on to the next point, right? Chew your food and swallow it before you move on to the next bite, right? So, for example, you might want to explain the signs and symptoms to look for and when to get help. Like I said, that's such an important thing. And then after you've checked and made sure the patient has that down, then you might want to talk about the side effects of a medicine. So step 2 is using plain language, and I like to say that that's meeting people where they are. So how many of your patients have gone to medical school? So when you think about it, using plain language isn't really talking down to them, right? They didn't go to medical school. They didn't learn. They may not have, most of the time, did not go to medical school, may not have learned all the terms. So you're just meeting them where they are when you're using plain language. But like I said before, some healthcare professionals think it's necessary to educate our patients up, meaning having them learn our terms for conditions that they already have their own terms for. You know, they might not have said puffy, that my legs are puffy, but they might have, but they definitely wouldn't have come in saying I have edema most of the time. I'm sure there's some patients that look it up and do come in and say that. But if we use everyday words in plain language, what it does is allows people to understand and process things faster. Okay, so using terms like puffy or edema requires the person to make an adjustment, maybe, especially when you use something like edema. They might know what that is, but they might have to think about it for a second before they can fully process it. And because they're trying to understand what edema is, they missed what you said about the edema. So the 3 or 4 words or 5 words after that, because they were processing what edema is. If you say swelling, the person gets it right away, right? And they can process that quickly and keep up with what you're saying then. So that's really the thing, is it's not that even a medical professional who's gone to school for some of these things, it might cause a little bit of extra processing time for them. We understand those terms, but especially in a professional light, but when we're in getting our own healthcare or healthcare of a loved one, we might need that extra processing time, or that might not have been our area of specialty. As an oncology nurse, I can tell you that I took care of several doctors and other medical professionals with cancer diagnoses, and that wasn't their specialty, so they did need help understanding some of the terms that we use in oncology and some of the devices we use that maybe they weren't used to using on a regular basis. So just something to think about there. So I did have a video to show, but I don't have the proper setup for it, so we're going to do this little activity verbally. So hopefully I can get through this. It's been a long time since I've read this. So I'm going to tell you a story, and I want you to think in your head if you can figure out what story this is. The pre-adolescent human situated her corporeal mass upon the structure intended for respite. She was ingesting a combination of high-fat solids and exudates derived from a common bovine excretion. An arachnid perambulated into her propinquity and lowered its corporeal mass in juxtaposition to hers. Her trepidation precipitated a phobic response, which impelled her to alter her spatial coordinates at a rapid velocity. Okay, if we were in an in-person setting, I'd say, okay, who knows what that is? And a couple of you might shout it out. A couple of you might look at me like I'm strange, like I'm supposed to know what that is. But it's a childhood nursing rhyme that most of us probably have heard at least once. It is Little Miss Muffet sat on a tuffet, eating her curds and whey. Along came a spider and sat down beside her and frightened Miss Muffet away. You can see how using jargon or higher level educational words can complicate a story that's fairly simple and make it take a little more time to process and understand. I think that's a good illustration of that. And if anybody wants to see the cute little video we made about this, it's adorable. Let me know, reach out to me after, and I will be happy to send you a link to it. All right, so how do we use plain language? We stop using medical jargon and acronyms as much as possible. Try using everyday words instead, right? So instead of hypertension and BID, let's replace that with high blood pressure and 2 times a day. Use those everyday words, things that you would say to anybody in conversation or in the living room with your wife or your children or your sister or brother, right? Sometimes even something like a professional title, like I said, jargon, medical jargon and acronyms, but even professional titles can be confusing. I actually had someone tell me a story that they told the patient that the speech therapist would be coming to see them. That they said the speech therapist would be coming to see them. Well, when the speech therapist came, was to the person's house, the patient would not let them in. And later when the nurse, I believe it was, went back and asked the patient, why did you not let the speech therapist in to see you? She was from a foreign country and had an accent, and she said, because I didn't want them to change the way I talk. The speech therapist was actually there to do a swallow study on that particular patient who was home. So right there, there's an example of how just our medical title, like to us, it's important that I'm a speech therapist or I'm a nursing professional development specialist. And these are all the initials after my name. And I get it. That's important to us as professionals. But to patients, they just need to know that I'm a nurse. They need to know that that person was there to do a swallow study. They just need to know what we're there to do. And then sometimes they'll say, what are your qualifications? And then you can get into that. Again, if a patient's ready and engaged in having more information, then obviously we give it to them. But we start out with only what they need to know and need to do. So sometimes you can't use plain language, or you accidentally use a term that might be hard to understand. So if it can't be avoided, just define the term in an easier to understand way, especially if you catch yourself, just say, oops, sorry, I probably should have told you that that is this, right? Hypertension is high blood pressure. You can even draw a picture for those hard to explain content, right? That hard to explain topic. Draw a picture or a word. Let's say you can't get around using a particular name for a test, then kind of draw a picture to show them what you're talking about, what they're going to be looking at, or what we're going to find out from that test, if that's something they need to know or want to know. So once you selected your key points, you explain them in plain language. The last step is checking and checking again if you have to clarify anything. That's just to make sure you were clear. So after educating a patient, it's common for clinicians to ask, do you understand? Often the patient answers yes or not. We already talked about that, right? The clinician will then do what? Document, verbalize his understanding in the medical record. Even though there was no proof given that the patient understood, they just nodded yes or said yes. You have no proof that they actually understood, and we're putting in the medical record, patient verbalizes understanding. So think about it this way. When a patient says, I have a fever, do we document their temperature as fever, or do we use a thermometer and take their actual temperature and then document the actual temperature? I know it's not exactly an ideal example, but that's one way of looking at it, right? We give evidence, we give the clinical evidence that this is their temperature, not just that they said they had a fever. Patient reported a fever, but their temperature was 36.5, right? Versus the patient reported a fever, their temperature is 39, they do have a fever, right? It's a completely different message, a completely different story that you're telling in the medical record, which is such an important record to tell an accurate story in. So by doing Teachback, you ask the patient to explain something back in their own words. They do that, and you're able to document in the medical record that they were able to teach back. And that actually says in that story that you actually asked the patient to explain things back in their own words, and they were able to do it. So if you said the patient understands how to take Coumadin, or patient did Teachback on the side effects and important information about Coumadin, you're kind of indicating that they're in a good spot, that they know what to do, and that they said it in their own words. So when patients don't remember or understand their plan of care, it definitely impacts their health, and usually that's negatively. So what are some of those negative impacts or outcomes? Increased preventable emergency visits, increased preventable hospital admissions, all these numbers that we're trying to work so hard on getting down, right? Increased medication errors. They miss follow-up services and tests because they didn't understand the directions before tests. Like maybe they didn't understand that they were supposed to fast before that blood work, or they weren't supposed to eat or drink before a surgery or a procedure. And then they come in and they've done it. And then what do? You have to delay that test or that procedure, right? And that's a delay in care for the patient. Not to mention you have an empty hole in your time slot now that you could have had a patient there, but you don't. They've got to come back later. It's wasted time, wasted energy. You also will see decreased use of preventative services, patients not going for the mammograms, the colonoscopies, all those important things that they need to go for to protect their health. Poor management for those that have chronic illnesses, diabetes, heart failure, cancer diagnosis, neurological, stroke, people that have chronic conditions. COPD, have trouble managing them. And when you have trouble managing a chronic condition, you get into situations that you feel are emergencies, and you end up in the emergency room again, or you end up in the doctor's office again, or you end up needing a prescription for another medicine that maybe you didn't really need just because you understood things incorrectly. Poor understanding of nutrition labels might seem like a trivial thing, but that is actually a big thing these days. I mean, think about obesity and what our nation looks like in the terms of physical fitness and in health and the places we eat the most, right? And it becomes, you see that there's actually, and all the impact that nutrition has on health outcomes and on disease states, right? On those chronic conditions that we just mentioned. So very important that they understand the nutrition labels as well. Not checking for understanding can also increase mortality, which makes sense when you derive it from all these other things I listed. So teaching and learning, a little basic concept here is what you taught equals exactly what the learners know, right? No, I just taught you all this stuff about Teachback, and I certainly don't expect that you all are going to be able to do this presentation, right after me for the next group. Spending a lot of time talking, like I'm doing right now, and teaching does not result in patients knowing or understanding more. What I taught does not equal what the learner knows, okay? So focusing, but I can do it more efficiently, right? Focusing on the key points and saying it in a way that can be understood, then asking someone to teach me back in their own words, that does show me what the person knows. Okay, so in her book, No Time to Teach, Fran London, a nurse, discusses how saying that you don't have time to teach leaves you with only one solution. You have to make more time, right? And it's an impossible solution. You have to find or make more time, which we all know is impossible to do. So in order to arrive at a real solution, Fran says, to the problem, instead ask yourself, how can I most effectively and efficiently teach in the time I do have? And there you go. That brings you back to key points, plain language, checking for understanding. So checking does pay off. Using Teachback will result in time savings for everyone. Think about it this way. When Teachback is not used to check understanding, you have to think about your staff's time spent on concerns received through phone calls or portal messages after the visit. So the patient didn't understand something, they walk out of the office going, ooh, what was I supposed to do? Or when was I supposed to come back? So what do they have to do? They have to call the office to find out or get on their portal and look, right? And maybe they message someone at the office. And here you go. Now your office staff or hospital staff or whoever have to spend time answering that question that could have been cleared up by using Teachback. So there's that time. There's your time spent on interruptions because of those concerns. So usually the person that gets the message isn't always the one that knows the answer and has to now interrupt you or another person on the team to find out the answer. So there you go. There's some more time added. What about everyone's time spent on those subsequent avoidable visits too? Because there's a lot of other people that are part, maybe the case manager also has to do something to make sure that patient can have transportation or social work to have transportation to that next visit that they wouldn't have had if we had done Teachback. How about your patient's time calling back, returning to the office for a visit, waiting to find out the answer, worrying about things, making sure they're doing things right and they're worried and upset about it. What about your patient's negative experience and outcomes that are a result of them not understanding? All of this can result in a cost of, not besides the cost of your patient's health, which is bad enough, the most horrible thing anyway. If you just want to look at it from a business perspective, cost of lost business right there. Not only is it inefficient and not definitely a wise way of doing business, but it's also lost business from word of mouth, because what is that patient going to say? Oh, I had to do this. Oh, that doctor talks in a way I don't understand. Oh, that nurse was so rude. She just hurried me out of the office, right? Versus taking that extra minute, do Teachback and confirm understanding, the patient gets a different sense from you, and it changes the way they look at the visit. Not to mention, that they understand and they know what they have to do next. So it's an investment that pays off. So how do you get your patient to Teachback in their own words? you ask them. What's important is how you ask them. I already touched base on that, what questions do you have for me? Using an open-ended question tells you a lot more than a question that can be answered with a yes or no. So are you going to take this medicine with food versus tell me how you're going to take this medicine, right? Describe how you're going to take this medicine to me. And then hopefully they mention with or without food, because you taught that and that was one of your key points. Instead of asking if they have questions, what questions do they have or what information they need? To prompt them to explain back what they learned from you, ask them in a way that makes it clear that you're not testing them, because that's probably the biggest complaint we have from providers that have tried Teachback that are kind of resistant to it, is they're like, oh, it doesn't feel right, and the patient feels like I'm they're upset that I'm even asking them, they get annoyed. Well, probably because it sounds like you're testing them. So maybe use a question like that kind of directs it to the family. Like, how would you explain this to your family member when you get home? It kind of takes the testing out of it. Since your wife isn't here with you, share with me what you're going to tell her about this new medicine you're taking, right? You can also focus on the fact that other patients have found the information hard to get, so that they don't feel bad if they don't understand it, or that you're just trying to be safe. And I incorporated both of those in this example. People often have trouble taking this medicine correctly, so just to be safe, would you explain to me how you'll take it? Somebody says that to me, I definitely get the warm, fuzzy feeling that they care about me and they care about my health, and I'm not feeling tested, and I'm not upset that they asked me. I'm glad that they asked me, because I don't want to be one of those people that's taking it wrong, right? Another caring way that you can ask is you can own your explanation. You can take ownership of it. So in other words, we talked about a lot of information, and I want to be sure that I didn't miss any important points. So can you tell me in your own words what your next steps are? It just really, like you're saying, I'm not making sure that you were listening. I'm making sure that I covered everything, that I did a good job explaining. This is so important for your health. So I want to make sure I did a good job with it. So can you tell me in your own words? It just really takes the emphasis off of the patient feeling like they're being quizzed or questioned or tested. So what some people find, like I said, it's hard to get started because questions don't always feel natural. That's why that Teachback moment is so important. And so something that some people find helpful is kind of scripting for themselves some words that work in advance. So like I said before, try choosing your Teachback moment, a moment in your practice that happens frequently enough that it'll be easy for you to remember to add Teachback to that moment, but not trying to do it on everything. Now think about that moment now in your head that you might be able to use. Start crafting a phrase in your head that you could use maybe to prompt any patient to do Teachback on that, right? And then when that moment occurs, when I give that Coumadin, that's when I'm going to, or when I give that Coumadin prescription, that's when I'm going to do Teachback on the things about Coumadin that I might have just explained to the patient. Okay, so that's how you you practice it, you memorize if you want, write it down, but I wouldn't bring out your piece of paper and read the script when you're doing it. I would just have it kind of memorized, and then when I'm giving the Coumadin, I start to ask my Teachback question. A lot of people find this medicine really hard to take, and they end up having to come back a lot to get doses adjusted. So I just want to be safe and make sure that everything was clear in your own words. Tell me the most important things that you learned today about Coumadin. Or tell me how you're going to take your Coumadin, right? Or what you have to do now that you're on Coumadin. So I have all these possible choices of how to word that. So I come up with my phrase, my words that work, and I use that every time. So here's an example. At ChristianaCare, we like to make sure that you have all the information you need to be sure I was clear. Can you tell me in your own words what your next steps are? It could be something as simple as that. So here's what happens with Teachback. What you're going to find is that key points are going to be missed by the patient. You're going to explain what you think are the 3 most important key points, but just like I do during this presentation, I talk a lot and I give a lot of information and I maybe digress a little bit, right? We do that in all our medical encounters. So you're going to give those key points, but there's going to be some other things in there which might confuse or take the patient off track. So when you do Teachback, you're going to see that they missed one of those important points that you were trying to make. So what can we do about that? When somebody misses an important point, rephrase it, don't repeat it. Repeating something back in the exact way that you explained it before is not going to help somebody understand if they didn't understand the first time. So you might just want to try saying it again a different way. Try different words, different ways. Oh, I've predicted my next bullet point. Break it down differently. Like if it was a chunk and check situation where it was a lot of information and you were chunking and checking, maybe you made one section a little too long. So go back and re-explain that section they missed, and chunk it a little differently. Evaluate and address learning barriers. So I already talked about that at the beginning, right? But let's say you're working with this patient today and you evaluated learning barriers, 2 weeks ago at their first visit, and you didn't reevaluate today because, it's an outpatient visit and they come back in 2 weeks and that's how you do it at your office. You only do a learning needs assessment once a year or something, right? Well, maybe the reason they didn't get it, maybe there's some different barriers. Maybe they didn't wear their glasses today. Maybe they need that support person. Maybe they had enough English knowledge at the first visit that they didn't need a translator, but at this visit, it's clear to you that they do. Okay, so whatever the case is, just rethink about those learning barriers or any learning barriers that might be coming up and address those. One of my favorite things is to ask a colleague to try. They might be able to connect with a patient a different way than you were. So maybe, especially if it's a really difficult concept and you've tried a couple times and there's nothing that's kind of hitting home with this patient, that might be when a colleague has a better way of explaining it, or just a different way of explaining it. Not necessarily better, different, and their way of explaining it connects with that patient, right? They also might see things a little differently than you do, or can come up with a really good analogy for something. And again, don't underestimate the importance of a home caregiver or support person in the room helping out. So make it clear to your patients that you welcome the inclusion of a caregiver or support person. It is one of the easiest and most effective steps you can take to help your patients understand and to ensure adherence to a plan of care. Something to know about this is support people don't always need to be present. I was a support person for my stepfather. He had a hospital appointment in Baltimore, and or not a hospital, a consultation with an oncologist in Baltimore, and wanted a supports person, but it was during the peak of COVID. So I got on the phone and talked to the provider. He actually put me on speaker. He put himself on speaker, and the whole visit I was right there on the phone as a support person and able to ask questions, confirm understanding as a support person, even though I wasn't physically present. And that can be documented in the medical record that the support person was given teaching, even though it was on the phone. Like, you can document that. You could also provide written information, links to websites, videos for them to review if they're not able to be part of the encounter. So maybe I couldn't be at that visit. Maybe I had to have a meeting myself at work that day at that same exact time. So if that's the case, then as the provider, you could send home information with the client, or tell them that I could proxy in on their patient portal, right, and check out what they were told, the office visit summary there. Or you could send me an email or some other kind of medical communication that has some websites to visit to find out what we need to know. So they don't always have to be physically present to be included. So let's think about how we can get started using those simple steps we just reviewed. We need to practice the skill. So, basics of Teachback. We're going to explain key points in plain language. We're going to ask a patient to explain things back in their own words, and then we're going to re-explain any key points as needed, right, and check again. That's all there is to it. We've had some feedback on patient experience surveys about Teachback, and here's some of the things that have been said. I appreciate the question that asked if the doctor asked me to repeat things back. Oh, I see I'm running low on time. I went a lot longer than I thought. Sorry, guys. Basically, I'll highlight the initial. Bravo, please continue to grow initiatives like this. 10 out of 10, one of the best doctors I've ever been to. I was very impressed, and we'll go back to him again. She took her service level to a 10 plus in my book. Would totally recommend the practice. So you can see our patients are showing, they're writing in on their surveys that the doctor did Teachback or the nurse did Teachback. We've even had, what about a medical assistant doing Teachback, and that the patient liked it and appreciated it. So practice makes perfect. Teachback might not feel natural or easy at first. It's a communication skill. It takes practice. Take your time and keep trying. Use additional resources to refine your skills. So don't just rely on this one presentation from me. Keep on going. See if there's more out there that maybe my way of teaching didn't hit home with you, but maybe another resource might. So be on the lookout for it. In any case, approach Teachback with an attitude of humility and a goal of keeping your patients safe and healthy. Your patients will sense your desire to help. They'll appreciate it, and they'll appreciate that you make sure that they know what comes next, and that will secure their trust. And we all know how important trust is in healthcare, especially these days. That's what I think is one of the biggest barriers right now, is people not trusting not just healthcare, the government, everything. So there's that lack of trust out there. So this is one way we can help secure trust. Now you have the basics and you can start practicing Teachback. There's more to learn to help you refine your skills, as I just touched on. But first, practice. First, start practicing what you learned here today. Teachback moment, words that work. Use it in your practice. And then we're going to be coming out with another course soon called Advanced Teachback Skills, and maybe we'll be back here next October for Health Literacy Month again with that one. I'm not sure, or in a future session. And you can get started using Teachback. Sorry, I don't have much time left, but if there are any questions, thank you for your attention. I apologize I took longer than I thought, and I look forward to hearing any questions, whatever questions you might have.
Thank you so much, Christine. Any question for Christine? Well, I have a quick question while we are waiting. The problem I would have, I think, is not sounding, or I would be worried to sound condescending.
Mm-hmm.
And I think it's extremely difficult, when you, ask someone to repeat something in their own words, which I think is kind of a condescending concept. Mm-hmm. I would have a hard time.
And that's what this course is about. It's about practice. You're not being condescending. There are patients who might be, let's say another doctor, that if you said, okay, repeat back, first of all, repeat is the worst word to use because you're basically saying, repeat back what I said, which does sound condescending. So asking them, explain it back, or in your own words, can you tell me about this? Can you tell me about that test you're going to have and what you have to worry about before the test? If you, again, humility when you're actually asking the question helps, not sounding like, hey, I'm making sure you understood, but I'm just making sure that, I covered all the key points and you heard all the key points and we're on the same page. Oh, I'm just worried about your safety. Like approaching it like that takes away that condescending tone. Also remembering that you're not talking down. I love to use the example of me being a nurse and going to get my brakes done with an auto mechanic. Are they in the back saying, I've got to go dumb it down for this nurse out here because I don't understand their automotive jargon, right? Hopefully not. Hopefully that's not what they're saying, in the back of the auto mechanic shop. Hopefully they're coming out and explaining things to me in a way I can understand, but also only telling me what I need to know. This is what we have to do to your brakes. This was the problem we saw. This is how much it's going to cost, right? And then if I have more questions, explain those things to me. So that's the thing that's why practice is important. And after practicing a little bit, you're going to have those problems. You're going to have those, this didn't quite feel right this time. And maybe you're going to tweak it. You're going to look for more sources on Teachback. And hopefully when I have the next class out, take the next class on how you can refine those skills a little further. But basically it's a matter of being humble when you ask the question, making sure the patient knows it's about their safety and nothing else, and not over asking the question, right? Don't do it every 5 minutes that you talk to a patient. Key points. What are the most important things? So it's a well understood concern. We do recognize that concern, and that's one of the big reasons we put this course together.
And I would like to emphasize also that it's also a good skill to have in research, because when you administer consent to patients, you really want to make sure that they've understood,
yes,
what the research is about. So I think that's really a very important skills for everyone, not only, physicians or nurses or health practitioners, but research coordinators and people who administer consent.
Absolutely. We just had a great presentation at ChristianaCare about that yesterday with Christine.
Yesterday. Yeah.
Awesome. Yeah.
Any other questions for Christine? There are some comments in the chat.
See if I can pull that up. There it is. All right, there's my my colleague there, my boss, Christy, giving me some kudos. Greg O'Neill. Thank you, Melissa. Great presentation. Another colleague, Amanda, thank you. For me, it's all about how I ask. Oh, Amanda, let's hear what she has to say because she's a great colleague. I think she was answering your question, Claudia. For me, it's all about how I ask that impacts the way the patient perceives my Teachback prompt. So she's basically saying what I said, like the humility, how you ask them is more the tone versus it feeling condescending. I always think it's the words too. I love the just to be safe. When I started hearing that as an example, I said, that's a good one. If somebody said just to be safe, I want to check this. You got me because you're worried about my safety.
Right.
If anybody has any delayed questions, feel free to reach out to me. I'm sure there's a way you can get my information to them, and you're welcome to share it.
Absolutely. Thank you so much, Christine. Thank you.
Thank you, everybody. Bye. Take care.